When patients come in with a chipped tooth, usually they're more concerned about the cost and the timing, such as can they get treatment the same day and how much is it going to cost and how can they pay for it. Patients always ask, can I get it done today? Do I need to be scheduled back? And I always tell them, if we have time in the schedule, we'll definitely try to do same day dentistry. We do crown same day here. And of course, we can do filling. So patients are very pleased when they're able to get treatment the same day and not have to go a couple days or a couple weeks with a chipped front tooth. So before the doctor comes in, I like to set the expectations early with the patient, depending on the size of the chip, where the tooth is located. I tell patients treatment can be anywhere from a simple filling to a crown, but once the doctor comes in and we do a proper exam, we'll come up with the best treatment plan for that patient's needs and longevity. So with patients, I like to tell them, yes, maybe we could do a simple filling. It'll fix the issue for now, but in a couple months it may chip again. So I like to kind of talk about long-term investment financially, that if we're constantly doing these quick fixes, they're going to be investing more if instead of we just did it the right treatment to start from the beginning. Even though it may cost more upfront, it will save them a lot more money in the long run. I definitely experience a lot of calls with patients asking if we do bonding in office. I like to tell them the difference between bonding versus veneer. A veneers bonding is with composite, which is more of like a plasticky material, whereas veneers are porcelain. And I like to tell them the difference in the materials and the pros and cons, like such as with bonding, it stains easier. You usually have to get it redone a lot more often, but it may be cheaper. But then veneers are more long lasting and they're porcelain, so they don't stain the way that the composite bonding does. So before starting a procedure, we always do a shade match. We have a shade tab. We always want the most natural looking result for the end. So I'll always hold up the shade tab. I'll usually pick the shade and confirm with the patient before we start, does this look okay? And we get it as close as possible, whether it's a filling or a crown. If it's a crown, if it's a front tooth, we can do staining. That way when patients leave here, no one else can notice that they just got work done. So I understand cost is a really big factor when deciding to move forward with treatment and anything in life. So I like to tell patients that we can stage their treatment in a way that we can prioritize what needs to be done first, and we can do it to fit their budget so that we can do their appointments that allows them to move forward rather than all at once. And I also tell them we offer third-party financing, and I like to apply with them in office. That way they don't have to go home and do it on their own. I can kind of help them out and get them started on that process.